argument about if you take the pill up until the point that you have menopause, and then go off, what would be expected around that time?
Like what the changes would be?
Yeah.
Like, basically meaning that the woman kind of like knew when she most likely would have gone through.
I think so. Yeah. Let's say she knew, like, oh, I'm experienced. Well, that's a question I don't know the answer to. So if you're taking birth control, would you know if you're starting to go through perimenopause or menopause?
Well, there are some women that actually continue taking birth control even into their 60s. It's almost basically another form of hormone replacement therapy. I wouldn't necessarily recommend it, but there are women that do that. I mean, I can touch briefly on how menopause works and what happens. And basically, again, I'm talking back to the two hormones, progesterone and estrogen. So first, the progesterone is going to decrease dramatically. That's the first hormone that kind of like backs off. And that's why often women right around menopause might have like a crazy heavy period for 2 weeks. I mean, actually, one of my patients, which is kind of interesting because she actually was on birth control. So talk about like, yeah, actually, so I guess it definitely does happen that woman starts. So this patient, yes, she had, I think it was like about 2 weeks, really, really heavy. And the doctor was actually recommending that she should get a blood transfusion. And I actually agreed with him, but one of the big things was, again, going forward, what to do about these really heavy periods. And so I realized that it was most likely that she was starting to go through menopause. She didn't want to. I have some patients, they don't want to go off birth control, and that's perfectly fine. And so and I don't prescribe birth control in my practice, but I said, I think what you need to do is you need to have a conversation with your doctor, and I feel that you would benefit more from having a progesterone-only birth control at this point. And so doing that, plus I also gave her a combination of what we call styptic herbs, or herbs that basically just help to dry things out. So the herbs actually worked really well. So they and I was having her starting them right before she would get her period, but also just changing from the form of birth control definitely helped. Because again, like the first hormone to back out is progesterone, and then it's estrogen that decreases. And we always think about estrogen because we think about like the hot flashes and the vaginal dryness and the mood changes and things like that. But it's actually, a big thing is also the progesterone in the beginning has a big impact.
Gotcha. Okay. That was a good breakdown of that explanation.